Have you ever stared at your dashboard and feeling like, wow, there are a lot of things going on, but your partners who are using your product services still a bit confused about all the numbers on there? Let's talk about how collecting data isn't the win. Activating it is. And what founders need to build to stay fundable, usable, and indispensable in the current state of care coordination.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
Welcome. Today we have Karen Josswick with us. We are at Point Click Care Summit. Every year we have so many different summits that we like to go to in the healthcare space that is innovation based or provider focused, clinical focused, and this one particularly is more senior care focused. And in the whole scope of things, there can be multiple elements when we're thinking about healthcare innovation. Now, what brought you to Point Click Care?
Yeah, well, I think one of the areas that I'm really excited about in the work that we do with our partners in the provider and payer space is that post-acute opportunity. There is so much opportunity for us to bend the cost curve, find good partnerships, improve quality, and really, it's all rooted in the patient experience. So to me, I'm really excited to be here and learn what people are doing and share some of the stuff that we've learned.
Yeah, from a cardiothoracic background, we know every time it's get patient out of the hospital, you're going to catch more bugs than when you're here and get you moving, go to rehab, right? If you don't have anybody, can PT tell them to go to some kind of facility?
Absolutely.
It's that connection piece of once they leave, how do I know as a provider that things are follow up to? And when they haven't left us, do we know what that transition looks like and not just wait and hope for the best?
Yeah. And ideally, when you've identified somebody who will have, cardiothoracic surgery, CABG is one of the models that is one of the surgeries that have been identified in the CMS team model. And so you really should be identifying those patients before, when you're scheduling the surgery, right? For those planned surgeries, so what's their discharge plan look like? Do they need therapy? Are they going to need support? Do they need to go to a rehab facility? What's their social structure look like? So those are things that I think organizations are now really leaning in. And some of them had these programs in play, but some of them don't. And so there's an opportunity.
Exactly. And even just talking about cardiac rehab, now we're seeing companies to do remote cardiac rehab for people are super difficult to even go to a facility once they go home, rural areas. And pulmonary rehab, where we even have people to do pulmonary rehab before they get into a thoracic surgery with us, right? So there's also different elements of these additional tools, remote care, that can support some of the layers that we weren't fortunate to be able to tap into nowadays.
Yeah, I think, Sabrina, you're highlighting, there's a big boom that's happening around care management and how do you leverage remote patient monitoring? How do you leverage digital health tools to help take care that would have normally been either not possible? You would have had that individual have to stay with a family member or go to a skilled nursing facility that they really didn't need to, but because of distance, they were kind of forced into. And so now technology is enabling care management, care workflow changes, which I think is so much better for the patient, right? So anyone, my husband's dad had a CABG not that long ago, and it's a big conversation around where do they go and how do we help them? And he was fortunate that he had a support system in play, but not everyone has that. And so if you can really think through where patients need to go and what their journey is going to look like, it's a big opportunity for.
Right. And the counterpoint is us providers, sometimes it's hard to predict that. However, once people get diagnosed, especially heart surgery, I remember during COVID time, we're considered emergency surgery, so you can't cut us. Elective, come back later type of thing, right?
Yeah.
Therefore, once they get to cath lab and it's critical, then we have to usually want us to schedule within that week.
Yeah.
And therefore, some of these people never thought they're going to have heart disease. And they're just like, oh, we don't have issues. I'm still doing everything I want. I'm moving tires. I'm doing that. What the opportunity I see is immediately as they identify for potentially surgery or long period of hospital stay, let's say renal failure and whatnot. Case management, that type of conversation could get started to plan out what they need perhaps after surgery, whether they live alone, that's why we don't want them to go home by themselves, or some other reason they perhaps are visiting family and friends. Now they have a case, then they need a surgery. I have seen that where people are like very upset because no one is really around them, right? Their family is not even here, but it's not safe for them to transfer somewhere else when we can provide here care right now.
Yeah, absolutely. And I think, you know, as a provider, it's great if you know who those high quality providers are that you can partner with. So if you have home health agencies or inpatient rehab or skilled nursing, whatever those groups are, part of a high quality network, right? A preferred partner that you have the ability to know, you know what, these are folks that they really understand our clinical pathway. They understand how these patients need to be cared for. They're going to provide the right kind of supports and education. They're going to make sure that they're successful so they don't get readmitted. They're going to make sure that the patients have a good understanding of their diagnosis and the behavior changes that are going to have to come, especially after surgery. And so I think that this is all areas that we've known as best practice for decades, right? Nothing that we're talking about is earth-shattering or new, but it's really an emphasis of how do you stitch it all together and weave it into a workflow and a process that I think sometimes we've lost, unfortunately. So,
right, it's that easiness of what's inside a hair can translate something that's trackable, and then it become a repeatable standard. And now we have a lot of tools, as we mentioned, like even remote care monitoring system, remote rehab, and then we have other platform point-click care, right? These integration of EMR system that we can continue the care plan into the next phase of where they needed to be, wherever that really meant, and then figure out where you are as a solution base to fill that gap. So what do you suggest people who, let's just say, someone like point-click care and their vendors, right, then best practice, how do they emerge into the systems of payers? I feel like sometimes they want it, right? But getting to this big conglomerate of these system-based, then they feel like they can never break in.
So I think, you know, the data is key, right? You have to be armed with information. And anytime you're going to have a partnership conversation, a negotiation, you know, and anything like that, you have to be armed with information. And so if you don't have access to data and you don't understand the market that you're serving, the patient population, the risk factors, the social determinants or the non-medical factors that are impacting these patients, then you're going to be struggling. And so I think first and foremost, individuals, leaders need to understand their data, and they need to understand where maybe they have blind spots. And if they have blind spots, how they can help partner with someone, right, to either, you know, elevate that, change it, or fill it. And I think that that's an opportunity that is, as we look at all of the models that are coming out, the changes that are happening in the eco space, the ability for you to look at your data is so critical. It's so critical. And in fact, I think that organizations that aren't aware of their data, they're going to be left behind, and they're going to struggle, and they're going to really, really struggle.
Exactly. It's not so much about just collecting data. It's how do we analyze it? What the pattern we're seeing? What's the trends? And what could be the gap are? And once you see it, what do you have to do to fill the gap? And who are the people in your trusted ecosystem that even you don't have that immediate solution, you can ask for those referrals?
And making sure that your team is skilled up, right? So not everybody can look at data and understand and translate that into an operational plan. And so making sure that you have the right partners, the right members on your team that you've either invested in or that you've elevated, that know how to take the data insights and then make it actionable. Because that's so important. Because you're right. Lots of us have reports on our desks and data, but if you're not able to distill it into very clear actions and strategies, it's just numbers and letters sitting on a sheet of paper. So.
Exactly. And I feel like that's the difference is when we're talking about talent, there are 4 natural quadrants that we see. There are the innovators, the true, I will create the best change, right? Like those captains leading the ship. And then you have the true strategists. They not necessarily like to create. They are like okay, tell me your best idea. Let's do something about it, right? Create a plan. And then you have the people who's like, okay, tell me your plan. I can make something actually happen into the implementation. Mm-hmm. And so I think sometimes people get confused between the visionary's plan to a strategic plan versus implementational plan, right? And they are all kind of trying to do the same thing to get to the goal, but in a very different lens. So if people don't really understand which lens they're looking at, it can be very difficult to make things work. And people feel like, oh, I thought we talked about this already. Why are we not already doing it?
Yeah. I mean, what you're describing is the case why change leadership is so important.
Yes.
In any project, any initiative that you undertake, right? The ability to understand where people are at, what information they have, what their background is, what their bias may be, and being able to respectfully understand that and help understand where people are at in that season of change, because there are some that are not ready for change and there are others that are going to champion the change. And so how do you help bring those folks forward to help you lead through these care transformation projects that organizations are going through?
Yeah, and it's so important to get people in the comfort of where they are, right? The people who are championing the change, how do you find them? And then when you find them, how do you help them to see their own natural gift and then put them into those right roles? Perhaps they haven't been playing that role. Yeah. Versus the people who are not really good with change because really they are good doers, right? They're just like locking down, I'm going to have a plan, I'm doing the thing. Yeah. So the proposal perhaps is not about the change, it's how do we support you to do your job even better, to get to the things much faster or easier and simpler. Yeah. I think at the end of the day, it's a perspective and then putting people in the right spot and promoting those who need to be valued, appreciated in this whole ecosystem. And sometimes it's hard because we have so many hands in the same pot, right? Like too many cooks in the same kitchen at a time. And to streamline that does take patience, communication, and then just simply an open mind.
Yeah. I mean, the number one job of a leader is to build other leaders. Yeah. And so that's absolutely our responsibility, is to think about how can we invest in our teams, invest in our peers, our colleagues, other female entrepreneurs. Like that the whole point is to invest in each other.
Exactly. And we definitely is a big champion for all the women leaders in the healthcare space. Yeah. I did a TED Talk on that, and it's super fun to be in those environments. Yeah. And then seeing it's really not a gender issue. It's actually how we perceive ourselves to be able to step up and stand out. There's so many of us in the healthcare workforce. Yeah. So we're so appreciative to have Karen here with us and to be a speaker in the summit. And there's so much more that we can learn from each other. So just like we talked about before coming on the show, is how do we all collaborate in that sense of integrating each other's work and not seeing us, yes, we're all experts, but we're only expert and we like to stay in our bubble.
Yeah, absolutely. And I think, recognizing that everyone comes from different backgrounds, everyone has different expertise. And so we're actually much stronger together when you have the ability to form teams that have varied backgrounds and different experiences. I think you get a better product at the end of the day.
Yes. So. And as we wrap up, we would love to hear more from your consultancy. I love it that you've been stepping out as an entrepreneur yourself and then really providing a very niche solution. And how can people find you as they needed to get in touch with you for your expertise?
Well, first of all, thank you for thinking of us, and we're honored. So Benevolence Health is a value-based care consultancy. We support providers, payers, digital health companies, and we're really focused on helping organizations navigate through regulatory changes, process, workflow changes, understanding the amount of tech that's coming their way is overwhelming sometimes. And there's an opportunity to have kind of a trusted partner to help you understand where you're going, what you need to be thinking about going forward. And so we do everything from strategic advisory work down to implementation. So, yeah.
It's very exciting in this time to be able to be everywhere and then still feel that you are in your core and being supported and highlighting all these niche areas that we can be involved in. We got connected on LinkedIn. Is that still a good place for people to reach out? Or
it is. Yeah, absolutely. You can follow me or follow Benevolence, follow both on LinkedIn. And I have to do a little bit of a shout out, Sabrina. We're both Jefferson folks.
Yes.
So we should play tribute to our roots. So Sabrina's a graduate of the Jefferson University, and I'm on faculty on Jefferson. So go Jeff.
Yes, for all of you guys. There's so many programs. I think I do enjoy my Philly years. And it was definitely after college, I was like, what do I want to do, right? Like applying a bunch of different programs. And what I love most about our program is it's a year long. You do it in 3 semesters. Mm-hmm. It's much more condensed possible, and it's nighttime. So I was able to work during the day and go get my public health degree. And then in that transition of working with Philly Public Health Department for their studies, and then also applying to PA school, it was definitely a good fit. So I appreciate everything that Jefferson have put together, and then looking forward to all the other amazing stuff that the school's bringing.
Yeah, the school's doing a lot. I mean, the College of Pop Health has, novel started so many years ago, and has seen a wonderful amount of graduates that have come through and are in all aspects. But just Jefferson as an organization, Jefferson Health, they're leaning in. There's so much growth and opportunity that's happening. So I'm really privileged to just be part of that organization and that team.
Yay, appreciate you.
Great. Thank you.
Until next time, definitely wherever you're listening and watching, we would love to hear from you. What are some things that you have been doing in the value-based care space? Are you a solution-based person, or you are an executive of a payer system? What are the specific things you're looking into when there seems like a lot of possibilities out there?
There's a lot.
So how are you working through that process of selecting the best ones? And then what we talk about collaborating with other entities to truly get to the point of being in the right support.
Yeah. Thank you very much, Sabrina.
Thank you.
Thank you.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.